Hello, this is my pronunciation on chapter 13 of the workbook. Chapter 13, the overseas doctor. A. Types of registration. The manage and treat patient in the UK. All doctors must register with the General Medical Council. There are several types of registration. Provisional registration is for doctors who have just qualified from medical school in the UK or from certain European uh, Economic Area member states. Full registration is for doctors who have completed their year's clinical training. Limited, limited, limited registration is for international medical graduates who have not completed the equivalent of a year's clinical training in the UK. Specialist registration is for doctors who have completed a specialist medical training and have a certificate of completion of training. Um, the GP register is a register of all those eligible to work in general practice in the NHS. A plan, plan, plan. Before they can obtain for registration, some categories of overseas doctors are required to take the Professional and Linguistic Assessment Board test. PLAB is designed to ensure those who pass can practice um, safely at the level of an SHO in a first appointment in a UK hospital. Part 1 consists in a written, a write, a written test of knowledge, skills, and attitudes. Part 2 is an objective structured clinical examination. It consists of 16 5-minute clinical scenarios known as stations to assess professional skills. C. Plan, stations, and advice. OSCES assess these skills. Clinical examination. Your ability to carry out a physical examination of a simulate patient and actor trained to pay this rule will be assessed. Will be assessed. Uncomfortable or intimate examinations will be carried out as using a mannequin, an anatomical model. Practical skills you will be assessed and practical skills such as suturing and giving intravenous injections. Communication skills. Your ability to interact, interact, interact will simulate a patient, or in some case, the examiner will be assessed. A skills test may include breaking and bad news and giving advice on lifestyle. History taking. Your ability to take accurate history and make a recent diagnosis will be assessed. Advice on the station from a successful candidate. Read the instruction outside each station read the instructions outside each station carefully. You have 1 minute minute for this. Don't forget the ABC: airways, breathing, circulation. Protocol in every emergency station. Um, Keep in mind safety precautions like throwing the sharps in the sharps bin. Check the patient understands what is happening, then ask them about any concerns they may have. Don't just give a lecture, listen carefully to what the actor says.